Hey guys, welcome to Basically Physio. We are exploring a new series called the Rehab Assessment Basics, and today at part 1, we are going through active and passive range of motion. So how I'm going to approach this is I'm going to actually go through the basics of each of the component of the assessment rather than going through each assessment for each joint. So why do you want to test the range of motion? You want to know the pain-free or the pain-producing range or the movement that is happening, and by testing the range of motion you get an understanding as to how effective the movement is being performed. And also you can postulate hypotheses as to where the issue may be for this client or patient. So a few things to take note. Just make sure that the joint or the area that you're testing is not very irritable, meaning the pain score is not high or severe, and the pain comes on and goes off fairly or rather quickly so that you can perform the range of motion testing for them. And also it's good to always check the unaffected side first to understand what a normal movement feels like. And main thing to also watch out for is make sure there's no recent procedures being done in the area, no major injuries or any fractures in the area that you're testing out. So coming to active range of motion. So for active range of motion, what I would like to say is, for example, Mr. X, can you raise up your arm as far as you can go? And this actually tests the available range of motion that can be performed actively for the patient. You can also check the ability for the muscles to contract, meaning the agonist and the antagonist, whether they are contracting with a correct timing and firing of the muscles, and also finding out which part of the movement produces the pain. So the active range of motion can be limited due to these few reasons. First thing, and the main common reason, will be muscle weakness, meaning the joint actually has the range to move, but because of the lack of strength, the patient cannot do a complete active range of motion. Next thing is muscle tightness, which is also quite common, whereby the length of the muscle is actually limiting the agonist from moving into the full range of motion. The next one is spasms. This can happen when there's an injury or there is any neurological deficits, and these spasms can be limiting the movements from performing fully. Next is another obvious one will be presence of pain, whereby moving further will just cause so much of pain that the patient or client cannot move past it. And lastly is due to stiffness or tightness, which is quite similar to muscle tightness, but this actually a little bit of it, or actually mainly comes from the joint inside itself. Okay, now for passive range of motion, to test this I would say something like this. Mr. X, relax completely, I will move your knee for you. And while doing the movement, I would always reassure them and do it slowly so that they do not guard against my movements. And what this test is that it actually gets you to understand the true available range of motion by feeling for the movement for the joint. And you can also understand where the pain is coming and whether that is the limiting factor. And passive range of motion actually gives you a total or better understanding of the passive structures that are involved, meaning how's the muscle length, what are the feelings that you are getting when you are moving the limb, and also the joint stiffness. So for the reasons why passive range of motion can be limited is mainly because of these. First thing is muscle length issue, which is similar to active range of motion, whereby the agonist and the antagonist, one of it is actually shorter, and this limits the range of motion for the available joint. Next thing is the joint stiffness, and to really get an understanding of this, you have to do some passive movements of the joint itself, i.e. this is known as joint play movements. Next thing is muscle spasms. This may be happening even though you ask the patient or client to relax. They may just happen subconsciously, and that may limit the passive range of motion also. And this can be accompanied with a presence of pain. And lastly, there could be because of neurological deficits, some things like spasticity or rigidity. This can actually limit the range of motion available for the joint. Now coming to some scenarios that you may face in the clinical setting. So if a range of motion such as the active range of motion and the passive range of motion is equal to each other and it's full range of motion, then this means that the joint is normal. For another situation where the active range of motion and passive range of motion is the same, but it is not at full range of motion, then these could be the probable reasons why that is happening. And lastly, range of motion whereby the passive is more than the active range of motion. This will likely mean that there is muscle weakness or neurological deficits, or pain could be present that is reducing the. So coming to end fields, there are abnormal and normal end fields, and this is usually tested during the passive range of motion. This is actually tested at the end of the available range of the joint. So these are some normal end feels, and these are expected. First thing is bony feelings, which is example would be the elbow extension, whereby there is a bony block at the end of the range. And next is soft tissue approximation. This can be felt during elbow flexion or knee flexion, whereby the soft tissue is blocking the joint from going further. And next is the tissue stretch, whereby you can do it in the ankle dorsiflexion, and the Achilles tendon will be actually limiting the range of motion. And this actually is the tissue stretch. So coming to abnormal end feels, the first two will be the muscle spasms or spasticity. For these two, it is quite similar in the sense that the stopping of the movement can be sudden and there may be some pain associated with it, and this actually occur earlier in the range of motion. However, for spasticity, there's a velocity element or component attached to it, whereby if you move it slowly, you can get the full range, but if you move it fast, then there will be some stopping of the movement due to the spasticity. The next one is a capsular end feel, which basically means there is like a tissue stretch feeling, but this is occurring at the earlier range of motion rather than towards the end of the range of motion. The next one will be empty end feel, and this basically means that the movement will produce pain and you're not able to move past the pain. And lastly, for the springy block feeling, this actually happens in joints with meniscus such as the knee joint, and if there is a tear in the meniscus, then there will be this springy block sensation that you get when you try to move the joint past a certain range of motion. Alright, thank you guys for watching this video till the end, and Rehab Assessment Basics Part 2 will be on manual muscle testing. And thank you for the support, and see you guys soon.